Hello. I'm Dr. Cho Imba of the Given Clinic in Seoul, South Korea. Today, I'll talk about hip fat transplantation. Recently, we've had a lot of patients who transplant fat into their hip. As people became more interested in their bodies getting breast implants in the early to mid-2000s. So many people got breast implants. Recently, I've been thinking that the area that people want to create that volume goes from their breast to their hip. So there are a lot of women who are very interested in liposuction. And there are a lot of women who want to create a full hip fat graft. That's why our hospital, which specializes in liposuction, doesn't throw away fat, but processes it technically to make pure fat, suitable for transplantation, and cell fat is applied to the area they want. I'll explain the cases of liposuction and buttock fat transplant at the same time. She's also in her early 50s. He came to me for a second abdominal liposuction and thigh lipo. If you look at the silhouette in the back, the upper side is protruding, the upper hip lower part is protruding, and the outer thigh lines are protruding. The most important thing about all body including the face is that if a woman's body can't be connected seamlessly, it won't feel smooth. An attractive woman's body line goes in as slimly as possible from her hips, and it flows smoothly to the outside of her thighs. In this patient's case, and by removing fat from the outside by lifting up her buttocks lines and adding enough fat to the sunken areas around her buttocks. So that's one of the advantages of autofat. In this case, from this patient had liposuction on her thighs. And although the thighs are nice and slim and well-shaped, the abdomen still had some fat. And the top of the hip wasn't too flat, but it was a little less curvy. So when it was about 3 months after she had her thigh removed from her side of abdomen and from her love band, and then I had fat grafted onto her depressed area of the hip and upper hip. It was 6 days after the surgery, and the line that on the connects to the pelvis didn't have any bumps. It curved in once and had the most volume from the outside of the hips and extended to the outside of the thighs. The patient was very satisfied after the surgery. If you look at the same patient's profile, you'll see that before the surgery, she moves from his back to his waist to his hips. If you remove fat from the sacral area of your buttocks, from the sacral area to the bra line, and carefully refine the fat that you suction, connecting it seamlessly from the top of your buttocks. As you can see, you'll have a slim but curvy buttocks. This patient was very satisfied after the surgery. This patient also underwent liposuction surgery from me 3 to 4 months ago. It's day 4 after surgery, so there's still some bruising. As I said earlier, the bra line clearly goes into her side, outer hips are the most protruded, and the outer thighs are slimmer, so you can see that she's feminine, quite pretty. This time, in the same way as the abdominal liposuction, these lines popping out, clearing the extra fat in the thighs, clearing the abdomen, and putting it in the buttocks. It's 2 days after the surgery, so the results aren't complete yet. There are some bruises, but the lower back and the outer thigh lines have improved significantly. This patient was also in her mid-40s, and her butt and the outside of her hips were drooping down. The skeletal lines on her lower back weren't bad, but she took out as much fat as she could to make herself look spry and used it for fat grafts. Compared to before the surgery, the volume has increased to the top. This patient received liposuction on her abdomen from me, and she lived abroad, not in Korea. She took the fat out of her abdomen and put it on the upper side of her hip. 2 years after the surgery, you can see that the fat on her hip has formed and maintained its increased volume. She was very interested in increasing the volume of her buttocks and wanted a large South American butt. So after a month and a half of transplanting fat from her abdomen, took fat out of her arms, and subsequently took fat out of 3 places. Due to the precision of the implantation technique, the fat attachment rate after surgery was very high, a lot so of the volume the patient weighed less than 50 she was kilograms. Very skinny. Skinny people don't usually have a lot of fat. Since she has little volume on her bottom and only weighs a little on her love handles, she was slim. So she didn't have a lot of fat on her sides. So she took out as much fat as she could and inserted well-refined fat on her bottom. This is a 2-year-old photo before surgery. Even though it's been 2 years, and the outside of his buttocks the area around her buttocks good volume. She was also a slim-shaped patient. She had a partially sunken hip, and the outside of her hip was a bit asymmetrical and flat and sunken. So she suggested putting fat on her hip without the love handles. After the surgery, the excess fat in her handles was removed. In the case of this patient, she's a bit slim. I believe her weight isn't over 50 kg. If you look at the back of her torso, the love handles on the left side were thicker before the surgery, and the right side was weaker for the left side. On the contrary, the sunken hips were wider on the left side, so you had to do some abdominal liposuction and put some fat in your hip socket and in your upper hip socket, and even though it was shot. The day after, the asymmetry of the love wheel became somewhat symmetrical, and even though it was shot the day after socket, you can see a significant improvement, but she had a sunken area on the outside of her butt had been drooping for a long time. So she got hip line fixed, and she had fat transplanted into her sunken area. After the surgery, the line from the love band to the buttocks and the hip line went up significantly, so the patient was very happy. She also did the same thing by adding fat to her buttocks, so that the hip line on her buttocks wouldn't droop down. You can see that the line that goes from the side love handles to the hip has become much more feminine than before. When you put fat on your butt like this, I showed you how it looks from the back. But the front is important too. It's more important what you think about the fat transplant done on her hip. And she had a dent on both sides of her hip. So he had a fat transplant done on her hip. And she had a dent done on her hip. As you can see after the surgery, the fat in the dent has survived well, and the line leading from the waist to the pelvis and thigh has disappeared, creating a very feminine and pretty line. There used to be a lot of fat on the side of the knee, but now that it's clean, you can see that the knee is narrower and thinner than before the surgery. If you look at her profile, you'll see that even though she hasn't had another surgery, her hip bone is sunk right below her pelvis, and the sunken hip goes all the way to the top of her hip. However, I've given her a good amount of fat in the sunken hip, and the sunken hip is also showing improvement due to the layer of fat. On the left side, you can see that the depression that pelvis has been successfully grafted, so it's much smoother. Lastly, this is a photo that I show my patients with them. I think it's a foreign model who took a photo of her from behind with her hands on the railing, and I think the lines leading to her hips resemble the lines that modern women like the most. I perform surgeries on you patients who come to me with the model in the photo. Today we'll talk about how fat grafting increases the volume of your buttocks. Use liposuction and liposuction safely and smartly.